Most welcome in this topic. Excellent choice. Let's cover the gross anatomy of the lungs in full graduate level detail. The type of depth you need for advanced anatomy, surgery, radiology, and respiratory medicine. Below is your AZ structured explanation of the lung surfaces, borders, lobes, fissures, hilum, root, blood supply, and clinical relations. Gross anatomy of the lungs. Graduate level. 1. Overview. The lungs are paired, conical, spongy organs for gas exchange, lying in the thoracic cavity on either side of the mediastinum. Each lung is covered by visceral pleura and lined by parietal pleura within the pleural cavities. Functionally, the lungs oxygenate blood and eliminate CO2. 2. Shape and general features. Apex. Rounded upper part extending above the first rib into the root of the neck to 2.5 centimeters above clavicle. Base. Concave inferior surface resting on the diaphragm. Surfaces. Costal surface. Smooth and convex, related to ribs. Mediastinal surface. Concave. Faces the mediastinum and contains the hilum. Diaphragmatic surface. Concave. Fits over the dome of the diaphragm. Borders. Anterior border. Thin and sharp. Overlaps heart. On left. Cardiac notch. Posterior border. Thick. Lies in paravertebral gutter. Inferior border. Separates base from costal and mediastinal surfaces. 3. Pleura. Visceral pleura. Tightly adherent to lung surface. Parietal pleura. Lines. Thoracic wall. Diaphragm. And mediastinum. Subdivisions. Costal, mediastinal, diaphragmatic, and cervical. Cupula. The pleural cavity is a potential space, with a thin film of serous fluid, is greater than clinical. Pleural effusion fluid, pneumothorax, air, or hemothorax, blood, can disturb this space. C. Right versus left lung. Comparison, feature right, lung left, lung lobes, 3. Supérieur, middle, inférieur, supérieur, inférieur fissure 2, oblique, horizontal 1, oblique size larger, shorter, broader, smaller, longer, narrower, weight to 625 grams to 565 grams, cardiac notch absent present, on anterior border lingula absent present, analogous to middle lobe. Relations liver, SVC, IVC, esophagus heart, aortic arch, thoracic aorta. 5. Fissures and lobes. Right lung oblique fissure. From T2 posteriorly. 6th costochondral junction anteriorly. Horizontal fissure. Along 4th costal cartilage meets oblique fissure midaxillary. Lobes. Superior lobe. Anterior. Superior. Middle lobe, anteromedial, between, fissures. Inferior lobe, posterior and basal. Left lung oblique. Fissure only divides lung into. Superior lobe, with lingula. Inferior lobe. 6. Hilum and root of lung. The hilum is the depression on the mediastinal surface where structures enter divided by exit. The root is the bundle of structures, passing through the hilum, enclosed in pleura. Contents of root. Each lung. Main bronchus posterior. Pulmonary artery. Superior. 2 pulmonary veins. Anterior and inferior. Bronchial arteries and veins. Lymph nodes. Autonomic nerves. Arrangement side relationship. At hilum right. Lungoparterial bronchus above pulmonary artery. Epiarterial bronchus. Left lung pulmonary artery above main bronchus. Hyperterial bronchus. Is greater than mnemonic. Rawls. Right lung artery is anterior to bronchus. Left lung artery is superior. T. Impressions. Visceral surface. Right lung cardiac impression. Right atrium. Groove for superior vena cava and azygos vein. Groove for esophagus, left lung. Deep cardiac impression, left ventricle. Groove for aortic arch and descending aorta. Groove for left subclavian and carotid arteries. 8. Blood supply arterial. Bronchial arteries. Supply bronchial tree and lung tissue. Right lung, 1 bronchial artery. From third posterior intercostal, or left bronchial. Left lung, 2 bronchial arteries from descending thoracic aorta. Pulmonary arteries carry deoxygenated blood from right ventricle to lungs. Venous. Pulmonary veins, 2 per lung, carry oxygenated blood to left atrium. Bronchial veins drain into azygos, right, or hemiazygos, left, veins. 9. Lymphatic drainage superficial, subpleural, plexus. Drains lung surface bronchopulmonary, hilar, nodes. Deep plexus. Drains bronchi and vessels pulmonary, bronchopulmonary, tracheobronchial, paratracheal, bronchomediastinal trunks. Is greater than clinical. Lymph spread explains hilar and mediastinal node enlargement in lung cancer. 10. Nerve supply. From pulmonary plexuses around bronchi and vessels. Parasympathetic vagus, nerve. Bronchoconstriction, vasodilation, secretion. Sympathetic. Tained 5. Bronchodilation, vasoconstriction. Visceral afferents. Pain from parietal pleura via intercostal and phrenic nerves. 11. Bronchopulmonary segments. Smallest functionally independent units of lung, each supplied by segmental, tertiary, bronchus, and branch of pulmonary artery, drained by intersegmental veins, separated by connective tissue. Septa allows segmental resection. Right lung, 10 segments. 1. Apical. 2. Posterior. 3. Anterior. 4. Lateral. 5. Medial. 6. Superior. 7. Medial basal. 8. Anterior basal. 9. Lateral basal. 10. Posterior basal left lung. 8-10 segments. Often fused in upper lobe. Similar pattern. 12. Surface markings apex. 2.5 centimeters above clavicle. Inferior border. Mid-clavicular. 6th rib midaxillary. 8th rib paravertebral. 10th rib pleural reflection. 1 rib lower. MC. 8th. MA. 10th. PV. 12th. Is greater than clinical. Safe site for pleural tap above 9th rib in midaxillary line to avoid injury. 13. Clinical correlations pneumothorax. Air in pleural space, lung collapse. Pleural effusion, fluid accumulation. Atelectasis, lung collapse due to obstruction. Aspiration pneumonia, more common in right lower lobe wider, more vertical bronchus. Bronchial carcinoma may spread via lymphatics to hilar and mediastinal nodes. Pulmonary embolism, blockage of pulmonary artery branches. 14. Radiological notes right lung. 3 lobes visibles, oblique plus horizontale fissure. Left lung, 2 lobes, visible oblique fissure. Hilum, left hilum higher due to higher position of pulmonary artery. Summary mnemonics. RAWs. Right artery anterior. Left artery superior. Right lung. 3 lobes, 2 fissures larger. Left lung. 2 lobes, 1 fissure, plus lingula. VAB. From anterior. Vein, artery bronchus. At hilum. Thank you for watching this video, Drite.